Welcome back. June is Men's Health Awareness Month, and colorectal cancer is the fourth most common cancer in men after skin, prostate, and lung cancer. It's highly preventable and treatable if caught early. Dr. Rustin and one of his patients, Bobby Riggs, here to tell us what you should look for. Good to see you, gentlemen.
Nice to be here, Dave.
Now, Dr. Rustin, what exactly are we looking for when we're talking about colorectal cancer?
Well, the primary thing we want to do is make patients aware of the fact that when they have a symptom such as bleeding, a change in their bowel habit, or some change in their normal daily bowel routine, they need to notify their primary care physician so that they can get appropriate care. Then from that primary care visit, or they can just call a specialist like us, then we can investigate it further to come to an answer to the solution.
Now, are there many times that people come in with a symptom and it's a false positive, they don't have to worry about anything, but it's better to get it checked out?
Well, Dave, actually there are, and most of the time it can be something as benign or minimal as hemorrhoidal bleeding or just outlet bleeding.
Yeah.
But the one thing you don't want to miss is a cancer or a precancer, because that can be a life-changing event.
And you should get screened for this about every 7 years, you said, starting when?
Well, beginning at age 50, if someone has no history prior of polyps or no family history of cancer, then it should be every 8 to 10 years.
But if you do have a family history, maybe get in even before that.
If you have a family history or a prior history of polyps, then it should be every 5 years. If you're an African American, it should start 5 years earlier at age 45.
Now, Bobby is one of your patients, and you did have a very serious situation, didn't you, Bobby?
Right. I'd had the examination, but it had been within the time frame. I was due to have another one in 2 years, but I experienced some bleeding, and it kind of concerned me. So I called Dolph, and he said, "You got to get in right away." So I did that. First, I prayed, like the country song that says, "Everybody wants to go to heaven, but they don't want to go right now." That was the case.
That's exactly right. And you were just hoping that it would be nothing.
Right. And I thought it would be nothing.
So what did you find out when you got examined?
I got examined, and they saw a tumor. And so that wasn't a good sign.
No.
So then I said, well, I want to make sure the doctor has done this before and is experienced at it.
You were smart about it, Bobby, because you did some research on your own, and what did you find out?
I found out that East Cooper had a very good or low infection rate, which sometimes when you go to the hospital, it's more the aftercare that you need, and the people there were outstanding. And they were all over the case. And
Dr. Rustin, this was in the old facility. You have a brand new facility where it's even cleaner, it's brand new.
Right, there's a new facility and it's wonderfully set up, and the hospital asked for our input, and we were able to, for the most part, get what we needed to be able to provide outstanding care, I think, to our patients.
Definitely.
The one thing I do want to stress is it takes a team of people to do this. We have a colorectal center of excellence, and it takes this entire team of people. I believe you have a picture that comes up of the core group, but everyone from the person who gets your information when you check in, the preoperative holding area nurses, operating room nurses, recovery room, everywhere.
There's your team. It's a good-looking crew there.
It's a great group of people that are dedicated to outcomes, and what we want to try to do is have a 90% as well as anyone in the country outcomes, and that's what we do here.
Now the big thing, Dr. Rustin, I mean, we don't want anybody to suffer from this debilitating disease. How do we know that we need to come in and see you?
Well, if you have, first of all, any symptom of a change in bowel habits, rectal bleeding, or anything that concerns you regarding your gastrointestinal tract, then you can come see us or go see your primary care provider or your gastroenterologist. It's really important to get that checkup. Be aware that this is a preventable death. We can prevent 90% of the deaths by colorectal cancer, which is the second leading cause of death in men and women in the United States from cancer. We can prevent it 90% of the time by just getting appropriate care and preoperative checking.
And I think Bobby's one of your biggest fans.
Well, I am. I know he saved my life.
Yeah, and that's what it's all about. So, Dr. Rustin, thank you so much. Bobby, glad to see you here.
Yeah, nice to be here, Dave. Thank you.
And hopefully we'll keep everybody else healthy out there as well. Thank you, gentlemen.
Thank you, Dave.
All right, well, if you're part of the military family, next segment is sure going to interest you. We'll tell you all about a program that's awarding financial gifts to local families in need. Don't go away.